It's a huge passion of mine to kind of get women functioning optimally. I developed a true interest and now a passion for menopausal symptoms and getting women who were 50 years ago retiring at 50. We need to be able to function better at this stage in our lives. And how do we ride this wave to get to the next phase? And how do I now catch them in their 40s and say, all right, how can we make this transition easier for you?
How do we change that perspective of we don't have to just accept this is just how it is for the rest of our life?
Even though the hot flashes may be mild, it is severely affecting your ability to function. But that mental fog and that brain fog, and they don't feel that they're as sharp, so therefore they don't feel as competitive, therefore they start to have self-esteem issues, is a far greater issue. I think the thing to be good at everything all the time, I think that's definitely an unrealistic expectation. You should just have to respect where your body is doing. I think it was also important to understand that cosmetically, women were demanding more.
I'ma kick back when you fake like that.
Welcome back to Beauty Unveiled. I am Dr. Angela Sturm, and I am thrilled to introduce my friend, Dr. Terri-Ann Samuels. She is a board-certified urogynecologist and committed to keeping women rejuvenated, tightened, everything where it's supposed to be.
Moving forward.
So, help me welcome Dr. Terri-Ann Samuels.
Nice to meet you. Thanks for having me.
Yeah, absolutely. So I've known you for a while, but let's pretend not, and tell me about yourself and what made you go into Urogyn and how you got to medicine kind of in general.
In general, cliche story, I think. Started out just young and loved my pediatrician. Realized quickly I don't like kids, and went into OBGYN. I always wanted to be an OBGYN. Journey took me to, I trained, I did my medical school in England. And it's a little bit different there. Mm-hmm. You do a lot more intervention as a physician. Midwives generally deliver babies. Came over here, started my residency, realized quickly that they're delivering babies over here. And I was like, oh, no, thank you. And I had a wonderful mentor who kind of guided me and liked my hands surgically, and somehow got me to Kenya in the middle of a residency. So you can imagine how crazy that was, mm-hmm. right? And I got a lot of flack for that.
Yeah.
But took me for a week to the Pokot tribe mm-hmm. near Tanzania, and we did fistula repair and a lot of vaginal reconstructive surgery, mm-hmm. and just loved it.
Yeah.
And then came back, and the specialty was just evolving. So I was number 23 in terms of fellowships at the time. And I went to Mount Sinai and had a wonderful time for 3 years. And then life happened, and I got a partner and a husband, and I got recruited by that place called MD Anderson. And so I was like, oh, we're going to Houston for 2 years. It'll be fine. I'll be back in New York before I know it. And mm-hmm. here I am 13 years later in Houston. Love Houston. But opened a practice. I worked with Baylor College of Medicine when I first came here. Very young specialty, so there were a number of positions. And then academics really wasn't my thing. Went to a couple of multi-specialty groups, and just for more autonomy and control and doing the best I can for my patients, I've gone into solo practice.
Yay.
So we're on the solo train, much inspired by Dr. Sturm. And here we are, on this new journey in solo practice urogynecology.
Obviously, by your accent, you're from Texas, right?
How'd you know?
I could just tell. No.
So I'm actually Jamaican. Don't tell anybody. I was actually born in Canada, so like I lose street cred. So please don't.
Oh no!
Yeah,
We
exactly.
can't tell anybody.
I'm Canadian. But yeah, no, I was raised in Jamaica. My entire family is Jamaican, and it's huge part of kind of who I am and how I was brought up culturally. Just a beautiful place, and I encourage everyone to go and visit. It's not a place; it's an experience. So here we are, the Jamaican in Houston. There's gonna be a song coming out. Not the Jamaican in New York. I'm the Jamaican in Houston. So here we are.
So being in all those different places, compare the medicine in UK versus here back home? Because I know it's got to be like different worlds.
Yes. So we don't have a socialized system in Jamaica. It's a third world country. People have to pay So again, with that, now Monday morning quarterback, there's a lot more weight to the emphasis on healthcare and what you have to invest to get things out of physicians. So physicians are at a little bit of an elevated level in terms of where they're respected in the society, and people actually really want to cherish and utilize that the information and the care that they get because they have to pay for it. Moving fast forward between Canada and England, and which are similar, right?
Yeah.
I worked for the National Health Service. Patients don't pay. I mean, they have high taxes. And so there really isn't any, stratification socioeconomically. You get kind of clear thresholds for how patients are treated, and it's dictated by the consultant on your floor for that specialty. And so you just take care of everyone. Great place to learn because then you're not having to ever think about the economic side of things. Downside is there's sometimes longer waiting times for things. And I think my answer to that a lot of the time though is that you're on the flip side, your child's appendectomy will never bankrupt you, right?
Yeah.
So emergency care you will get when you're supposed to get it. And so I think recently they've kind of had a tiered system where you can actually pay people for stuff, which, if that's where your value lies and where you're, then you can pay for it. And I think that's reasonable. So I think like all health systems are going to eventually get to that point, whether we like it or not, right? To keep a healthy society.
Yeah. Just to make sure people are taken care of. And like you said, it doesn't bankrupt you if you have something that you can't control, which is awful. Right. So so tell us exactly what urogynecology is.
Ooh. Permission to speak openly?
Of course.
So urogynecology, so we call ourselves the quarterback of the pelvic floor, right? There are 3 holes, and for those who didn't know that, there are definitely 3 holes. I see them all the time. So there's a front, middle, and back, right? And so that used to be handled by 3 different docs, right? Your front, which is your urethra, was managed by the urologist. The vagina was managed by the gynecologist, and then your anus and rectum were managed by colorectal surgery. So we just saw the need with a lot of the pathology coming out of OBGYN to really wrangle this aspect of the pelvic floor. So we do manage all 3 of those holes very comprehensively, and then and as we go further up, then we kind of deal with our colleagues going forward. So that's kind of what urogynecology is. And then for me, I was, this is the galaxy. This is where I live. So I think it was also important to understand that cosmetically, women are demanding more. Yeah. And coming from my training and knowing that anatomy, to be able to provide the best service in terms of improving functionality, but also look and feel of the vagina, right? Because sex is also very important for us. It's important for our own development and happiness. And I think there's a societal push from women to really make it enjoyable, since this is something that we engage and it does help us, right? So that's kind of how that evolved. And then I ended up in, you're doing surgery on these patients, and all the patients that had their hormones replaced and were not fighting with menopause and happy were on, hormone replacement, which was when I was a baby doc, that was the era where we took everybody off of hormones. And so the evolution was like, well, let me check into this. And so I developed a true interest and now a passion for menopausal symptoms and getting women who were, 50 years ago, retiring at 50, these women are now taking over the world. Their engine is being revved at 50, but it's not our fault that we have this massive pause that comes, from the physiologic gods, right?
Right.
So we need to be able to function better at this stage in our lives. And how do we do that? How do we ride this wave to get to the next phase? And so it's a huge passion of mine to kind of get women, functioning optimally.
Yeah. See, perfect. I was going to ask you what your passion is. That's it.
Things down below. But menopause, you are more, we are all more than our vagina, right? And it's part of a system, and it's part of who we are. And everything has to work together, right? And so, it's funny, as you go along, as I've gone on this hormonal journey, right? Like, okay, so we optimized your hormones, but where are hormones made? Well, technically hormones are made in your gut. Okay, well, if we're talking about things like, and obviously we deal with anorectal stuff, but we're talking about constipation. If your bowels aren't working, it's hard for you to activate the substrate to make hormones, which is cholesterol. And so it keeps going further and further back in terms of how we manage women, how we make them better, so that, and then we're getting better at, okay, so hold on, I can now stratify and see, these are the women that are going to sail through menopause, and hold on a second, these are women that are going to struggle. Yeah. And how do I now catch them in their 40s and say, all right, how can we make this transition easier for you?
Because it's coming in your 40s. You're like, oh, this is it. This is the beginnings. And there's so many things you said that we've talked about this, that the symptoms like the constipation and a lot of the different menopause symptoms that women just accept as this is normal, and how do we change that perspective of we don't have to just accept this is just how it is for the rest of life. We have 50 more years to go, 50
more years to go. And again, so that 40s would be what everyone's talking about, we call perimenopause. And I think that the issue initially, now that it's becoming more mainstream, is to start using vocabulary, right? Mm-hmm. Because even conventionally, we've talked about perimenopause as it's when your periods start to, come and go, like, well, that was happening since my 20s, so am I in perimenopause or not? Like, it's so. And then when you're in postmenopause, you have not had a period in 1 year. Well, I've had a year before that period stopped, I've been feeling like I'm going crazy. Mm-hmm. I'm not sleeping. I am not pooping. I am peeing weirdly. Sex doesn't feel good. My brain fog. I'm hot flashes, night sweats, right? So the list goes on and on. Mm-hmm. And then you're feeling like your body is just failing you, And you saying that makes so much sense, because what the definition is someone from the outside. Like, how do they objectively define that rather than someone from the inside who's describing the way it feels? And so that definition was coming from someone who's never felt it before. They were men.
So it's not, that's much more intuitive to have that female's perspective of these are the things you're going to feel, because you start feeling it way before that period stops,
Absolutely.
And then if you're in medicine or professional and then you're having babies at the same time and it's all the things all at once and you're like, is this because I'm having babies? Is this because I'm going into menopause? Is it both? It's both happening at the same time. Yeah. And you don't know what's what.
No. And worse with professionals who are A-type personalities, our nature is to just push through, right?
Mm-hmm.
Like,
just keep going.
Yeah, just keep going. It'll fall in line. But that's a lot to ask of anybody, right? At any stage in their life. And again, I remember my grandparents retiring at 50. Mm-hmm. I remember them coming home. My grandmother was at Sears in Canada, and this was her check. And I mean, she's like 88 and still having a check from Sears, right? You retired at 50. You got a package, a watch. I mean, this was it. And now we've opened up the doors for women to go and go get it, right? We've revved your engines. We've given ourselves resources and we've educated ourselves. And now we have the experience now to take over the planet. Mm-hmm.
That's your peak point. 50 is like, you're peaking.
Peaking. And then your body stops cooperating.
Like, come on.
Exactly. We can do this, And again, it's the other thing is, I always ask the question, and I always ask the question of, when I'm asking about different symptoms, mild, moderate, and severe. And I think it's always weird for women because they're like, mild, am I having mild? Well, I've not talked to my girlfriend, so I don't know if I'm having mild, moderate, or severe, but I always have to reframe that as that it doesn't matter relative to your girlfriend if you're having mild. If you're having mild, quote, or what your definition of mild hot flashes are. Now, I have patients who flash every 20 minutes. You may be having 2, and you think relative to your girlfriend that's mild. But if that hot flash is happening as you are the CEO of your company about to ream someone on something that they did bad, right? And you're sweating in the middle of the boardroom, that's enough to severely affect you. Mm-hmm. You know what I mean? So even though the hot flashes may be mild, it is severely affecting your ability to function. So that is not relative. That is relative to you being a better you. And whatever that symptom is, some people don't care about their hot flashes. Yeah. They have a flash occasionally, but that mental fog and that brain fog, and they don't feel that they're as sharp, so therefore they don't feel as competitive. Therefore, they start to have self-esteem issues. is a far greater issue, you know? So like, you know, you have to do you know?
What's right for you. Yeah.
Do what's right for you.
And it's good to quantify that for people because, like you said, you have no idea. You're like, I don't know what mild, moderate, and severe is. It's like when I was pregnant and they were like, okay, no stressful days. And I'm like, how many hours of operating is that? Is that 2? Is that 8? Because I have 8 to 10 hour cases sometimes. And they were like, oh, I thought you just did fluff. And I was like, well, the people's faces that I operate on don't think it's fluff. Everything has to be put into context of like what that person's life looks like. So that totally makes sense.
Even those cases, like, you know, surgeon to surgeon, right? Like, it depends on what that case is. There are cases in your mind that are very simple. And even if you're there for 10 hours, you're like, I'm rocking this, right? Yeah. And then there are cases that are more complicated that are 2 hours. And you're like, oh my gosh, like. You're
mentally exhausted afterwards. You're like, okay, I'm going to go sit by myself for a little bit. And nobody talk to me.
Don't talk to me. PhD in silence. Yeah, no. So it is all relative to how you feel. And the kicker is, I think a lot of patients is that they will come in and everyone has that one girlfriend. Everyone has that one girlfriend who has like sex 4 times a day, is sailing through menopause, working out 4 days a week, you know, I mean, and you're like, wow. Like,
I don't believe any of it. It's all nonsense.
It's all nonsense.
No. There's something bad going on in that person's life. I don't believe it.
So true.
There's balance. You always have to have balance. Nobody's perfect.
Nobody's perfect. And so don't ever listen to this journey is not relative to anybody else but you. Like you should just have to respect where your body is doing. And the biggest predictor is going to be what your mom went through. And even that, you're still the genes of 2 parents, right? So that's even hard to use.
Well, and then some of us, like our parents are stoic. Like they could have gone through the worst thing ever. And they're like, it was fine. It was fine. So it's hard to gauge that, you know, like my boomer parents are super tough. They could be on death's door and they're like, I'm fine. Like, let me help you, please. You know, so you may not really have an idea until you go through it and you're like, oh my gosh.
Right.
No, we can do something about this. It's okay to do something about this.
Right,
you know?
Right. And again, a definition of hysterectomy was that it caused quote unquote hysteria, right? And that hysteria is menopause because you took her ovaries out, which has nothing to do with her uterus, right? And so it was that we were probably hysteric because they dropped us into menopause. Right. And would the same thing happen if I castrated every male and took away their balls? Absolutely. It would absolutely happen. You would go crazy. So yes, I mean that is a real. But then you also, you know, the kind of thing where you don't want to fail, right? And so. And that generation, you are now admitting to the fact that a natural process is allowing your body to fail, and that's hard.
It's hard. It's hard, and it's also accepting you're at this stage of life, you know, because in our head we're all 20, right? And then you have to accept, okay, maybe, you know, I'm at the next stage, and then there's a stage after that, and that's hard. You know, it's hard on all of us. I think, you know, she's like, no, I'm going forever. You know,
not slowing. No, it's hard. It's hard for them.
And people living longer, there's more time, you know, in those stages.
Yeah. The crux, the most important question that I think I ask most of my patients is, what do you want to be when you grow up? Because that is a potential for most of us. I mean, some of us won't make it. I get that. But for most people, if you're talking about 50, I'm talking about 35 years. The same question you ask your kids, like, what do you want to look like? What do you want to feel like? Yeah. Because at the end of the day, if you don't start planning that now, you cannot start at 80. You know, if you're going to pop your clogs at 85, like that's a waste of time. So you got to figure out where you want to be, you know?
Yeah. What you want that to be.
What you want that to look like.
Yeah. Changing gears a little, we talked about you have 3 kids. So how do you balance the 3 kids, the private practice, the social life? I'm
going to slide down in this chair right now.
Juggling it all.
Yeah, but I think that's the perfect word. Like I think the word balance is poisonous, especially for an A-type personality. You know, you visualize things, you see things, and, you know, when you talk about the word balance, you see something completely level. And And that also has to do with the emotional state of everybody. So you want everybody to not only be functioning out of the ER, right, and healthy, but you also want them to be in an emotionally healthy state 24/7. I mean, technically, right, that's balance. And I just don't think it exists. And I think it's striving for that in certain personalities, and myself primarily, like you feel like you constantly fail, you know? So I think juggle is a great word, you know, and sometimes things are up and down, but knowing, you know, having one gray hair on my head is that the ball goes up, it comes down. Right? So things may seem out of whack, but sometimes you have to stretch yourself. But I think the more important thing is to make sure that you're true to your own value system. And what your values are as a family, and making sure those things are attained, you know, whether it's education or sport or, you know, making sure you're getting and giving enough affection and picking everybody feeling valued and figure out your own formula. Yeah. You know, and don't be ashamed of that. But I just don't think balance exists.
No, I think it's like you can have it all, but you can't have it all at the same time. You have to pick at different times what it is that you have and what's important to you. And I think I agree with you. I feel like it's been a disservice to like our generation of you can have it all. You can be the career woman, you can have the family, because then you expect yourself to do it all the time. And even with like wonderful partners, you can't do it all. You have to. You're like, that's your job. I'll take this, and that's your job, and then we'll swap next week or whatever it is.
Absolutely, and I think the thing to be good at everything all the time, I think that's definitely an unrealistic expectation. You know, I think if you asked me, you know, before, would I be cooking for my kids? And this is just one example. I'd be, oh yeah, of course, I'm cooking these healthy meals and blah blah blah. That is not happening. Okay, it's not happening. I don't enjoy cooking. Right. I enjoy cooking if I have a girlfriend with a glass of wine on Thanksgiving and we start at 6 a.m. Like that, I enjoy. The idea of like coming home and figuring out how to get 4 palates happy. Is and having some, and my ego gets attached to it because one of those guys go, oh, I don't like that. Then I want to reach over and squeeze you, you know? so like, why put myself in that situation? Let's just keep it simple, right? Yeah. You know, as long as you're healthy and, you know, you're getting a balanced diet, and you're not in the ER, we're winning, you know? So I think I've had to let go of the expectations in terms of what I thought motherhood would entail and create my own formula, you know?
Yeah, absolutely. I think we have to, because it can't be what my mom did, and it definitely can't be what her mom did. It has to be what works for me. I think my family was like, oh, the guy's going to stay home. Oh, okay. But it works for us, you know. That's what we have to do, you know, and everybody's going to be something different. So.
Absolutely.
So do you want your kids to go into medicine?
Knew she was going to ask me that.
It's a big question.
Sliding on the chair further.
She's like, why did I sign up for this?
No, I think eyes wide open. I think now I've learned, you know, I love what I do. I can stay locked in a room with a patient all day, right? And solve problems. But firstly, I think in this day and age, as medicine is getting so difficult and it's requiring such a mega sacrifice, the only thing that gets me through each day is the love for my patients and my pathology and making and problem solving. So I would only encourage them if I feel that they have a true passion for the mountain they're about to climb, right? You know, I wouldn't encourage them to climb Mount Kilimanjaro if you can't run rice. Like it's just not your thing. And so I think that's where I would be screening as a parent. If they have a passion for it and a passion for taking care of people, then I would encourage them. Other than that, you know, there's a lot of other ways that you can utilize your brain power to change the world. And I think, you know, careers have become more diverse and interesting. And so I would encourage them to explore all different things.
I think so. You have to know what you're getting into. And I think most of us didn't. Like, I always describe it like the military. Like, you sign up and they're like, you're going to be a pilot. And they're like, no, you're cleaning the like, but I thought, and they're like, sorry, it is what it is. You're already too far in. So it's a wonderful career, but it's being more, informed of what it is and what you're doing. And,
And I think, what's different here than in the other countries is the business of medicine. And I think the reality, whether you're taking insurance or not, I think we are now forced as physicians to understand the business of medicine. It's not an option. I don't care if you're in academics or in private practice. You have to understand how that money flows because the people that are around you, they definitively understand it. Much more than we've ever understood it. And you can't protect yourself or your colleague or your profession or your patients.
Right.
Unless you get it.
Right. I think that should be part of medical curriculum. It's just the business of medicine. I think we have to do that. We have to make that change because otherwise everyone suffers, us mostly, but the whole system, everything really.
Yeah, absolutely. And I think as women too, we're at a huge disadvantage because then you're kind of having to learn to put up, and I think if you're, my biggest growth curve has been kind of recognizing my own worth, right? Like that is a constant struggle, right? And having to price that and understand what you're giving, and because the insurance has taken the liberty of putting that price tag on with all kinds of factors. So, like, I think that is a constant struggle and will be. And I think women, we are always at a deficit when kind of owning our value. But I encourage all women to really make sure that you dig down in that and don't be afraid, know?
Yeah, I think that's really important. That's things that I tell fellows or young physicians is know your value. If you're coming into a situation, know what you're bringing to the table, and like you said, own that. And I think that's really important because as women and physicians, all of those things, we're always putting other people first, which we should take care of people, but you have to take care of yourself and do that. So,
well, you taught me that. I know. She's been kicking my butt for a while now. But it really was very, very difficult to kind of own that. That was definitely a lot of sleepless nights to get to the point where I was like, right, I'm providing something that I can only provide care under these circumstances, the care that I want to give you.
Yeah.
So
which is very important.
Thank you.
Well, thank you for coming and spending your time with us and answering all my questions. Make you slide down in the chair.
No, that's awesome.
Oh, we're honored to have you on, and share with us your social media handles. If anyone wants more information, they can go to your website and social media.
Social media. So I'm the pelvic MD. Essentially u.care, HoustonUrogynecology.com. Look us up, and if we're a good fit for you, we'd love to have you. So happy trekking.
Yeah, thank you so much. And thank you for joining us. If you like this episode, please subscribe and share with your friends and family. If you want more information about me, my website is www.drangelaSturm.com. And thanks for watching.